Is it showing on your side?
Yes, I think so.
Fun.
Uh,
Recording has
yeah,
started.
yes, it says yes. We're good
Brilliant.
to
Right,
go.
okay. Good to go. Right, so welcome everyone. I just wanted to briefly introduce myself and the purpose of this conversation I've got going on this afternoon. So my name is Amy Marlin and I'm the Superintendent Pharmacist here at Weldricks. I've worked as a community pharmacist for nearly 8 years now. Seems like a very long time. And I must say I find this topic around pelvic floor conditions one that patients really usually find embarrassing to discuss openly. So I hope today we can sort of break this barrier, start the conversation, and offer solutions to a condition that potentially affects a lot of people currently. So this is why I'm very, very excited for our guest today. So what I'll do is I'll pass over to Aoife to introduce herself, and then we'll dive into the Q&As if that's all right.
Oh,
Aoife,
thank
that's
you.
all to you.
That is lovely, Amy. Thank you so much. And hello, Weldricks UK customers. Absolutely delighted to be here to talk to you. So, as Amy said, my name is Aoife Ni Eochaidh. I'm a chartered physiotherapist and clinical specialist in pelvic and women's and men's health physiotherapy. And I'm absolutely delighted to be here today with Amy talking about all things pelvic floor training and I suppose the problems, how common it is and the solutions, what can be done.
Yeah, I'm really, really excited because I think it's going to be an eye-opening conversation. So I'm very looking forward. So thank you for being here. So what we'll do is I thought what would be a good idea would be to start from the basics. Let's start
Yeah,
from the question of what is the actual pelvic floor and where is it
yeah,
located? Because I think some of our customers might want that insight of,
yes,
anatomy. So if we start there
yeah.
and then sort of build the conversation, that would be really
e-
good.
Excellent. So I really like explaining where the pelvic floor is at the start of any talk that I do or any interview, because as you say, Amy, it is a mystery to a lot of
Mhm.
people. So if you imagine the area of your body between your waist and the top of your legs, that's where your pelvis is located. It's a large circular bone, a
Mhm.
little bit like a basin, really.
Mhm.
And these pelvic floor muscles that we're going to be talking about today are located in the base of this pelvis.
All
You
right. Yeah.
could think of them also, Amy, as, we're all very familiar with where our core muscles are or our tummy muscles. So you could think of the pelvic floor as the floor of the core. So that's where they're located.
Oh, that's really, really good and definitive of where to find them. So that's fantastic.
Yeah.
So in terms of how much leakage is normal, because I know like some patients come to me and be like, oh yeah, I had a bit of a cough and I had a little bit of an accident and it wasn't a lot, so I'm not worried about it. So what would you call normal in terms of leakage? Do you actually associate normal with leakage at all?
Yeah, well, Amy, I'm so glad to hear you ask that question because I'm always saying I'm like a broken record here.
Yeah.
But no amount of leakage is normal at
Mm-hmm.
any age. I
Mm-hmm.
often, as well, know more than yourself with your customers in the pharmacy, my patients in the physio clinic. Recently now I was talking to a lady, she was in her early 40s, and she was a mum of two. So she was
Mm-hmm.
saying, well, I'm not too bad, Aoife. I have a little bit of leakage, but I'm a mum of two, I'm going in perimenopause. That's normal, isn't it?
Yeah, oh, that's
So,
it, isn't it?
oh, it's not even a drop is normal. Whether you're a man, whether you're a woman, no matter what age you are, it shouldn't be happening. And it's so treatable.
Fantastic. And I think that's really good message for patients to take
Mm,
away is no amount is normal.
yeah,
So if they do experience it, they need to be seeking some support as
yeah,
well.
yeah.
Fabulous. So what would you describe are the main benefits of training your pelvic floor? Like what would be the
Yeah.
benefits of
Yeah.
joining pelvic floor training?
Yeah, so it's really important. So there are a range of problems that you can
Mhm.
have as a woman and as a man if your pelvic floor muscles aren't in the normal range of function. And I
Mm.
suppose if we talk about the bladder first, one of the most common things we see is bladder leakage. And
Mhm.
that can be a leak with the urge to empty the bladder, like an overwhelming urge. You can be absolutely fine. You arrive
Mhm.
outside your house, you see your front door, you put your key in. It's often called, latchkey incontinence. So that's one type of leakage from the bladder. And then there's another type, which is from exercise, coughing, sneezing, so that's one condition. Now, also, you could have overactivity in your bladder. So where you're going very off. So you mightn't be leaking, but you're like, oh my goodness, I have a risk of leak. And I'm going very often. It's very inconvenient. I'm drawing attention to myself. I can't travel. And then worse still, Amy, you could be up at night, so you're sleep disturbed with going to the bathroom very often. So
Yeah.
those are the main sort of bladder conditions, I suppose. The other one to say as well is, sometimes you have an issue if your pelvic floor isn't in the normal range with fully emptying your bladder correctly.
Right.
So those are the main, sort of bladder side. But you can have exactly the same things from the bowel side of things. So you can have control issues with the bowel, where you have difficulty controlling gas or wind, difficulty controlling stool. You could have seepage, soiling, but you also could have an emptying problem with the bowel, difficulty fully emptying. There's
Yeah.
two more really main ones, or three, I suppose. Prolapse is an issue that mothers get by and large, even moms that have had cesarean section. And prolapse, Amy, is where the organs come down in the pelvic floor.
Yeah.
But again, pelvic floor muscle training is evidence to treat prolapse. Just another couple of little things then, sexual and in particular erectile dysfunction is also linked to a poor pelvic floor. And then the last one then is pain. If these muscles are not working right, just like if any other muscle in the body, if you had a very weak leg, you'd have pain in the leg. So you can have pelvic pain. But by and large, the main thing we see is bladder problems.
Yeah. Yeah. So that's the
Leakage,
main. So that's
that's
the
the main
main
thing.
one that
That's the
you see
main
in your
one.
clinics,
Yeah,
right?
yeah, yeah,
Yeah.
yeah,
Yeah. No, that's really, really informative, and I think it's good for us to understand potentially how much the pelvic training can solve
yeah,
a lot of solutions. And from
yeah,
some of the things you've mentioned there, I can see how infection control can happen. So if you're having issues emptying the bladder completely, what other complications can arise from that? So I think it's really,
yes.
really good to know.
Really, really,
Yeah.
really, really important. And Amy, in 75% of cases, if
Mm-hmm.
you train your pelvic floor, it will cure urinary leakage in women.
Oh,
I
wow.
mean, that's huge.
That's
And then in the
massive. Yeah.
other, it's massive. Like it's something you can do for yourself. It's not that difficult. And in
Yeah.
the other 25% of cases, Amy, they will be improved, those women.
Mm-hmm. Mm-hmm.
So, and we have this evidence for a long time. Much of it came from the UK. I did my studies in the UK in Edinburgh and in Bradford. And, really since the 1950s, we have good evidence to support pelvic floor muscle training for leakage.
Yeah, yeah. I'm
Yeah,
surprised that it's not commonly talked about. Like it's something that's got a
yeah,
huge health benefit, but we
yeah,
don't talk about it enough. So
yeah.
yeah. So what I'll
Amy,
do, I'll move on to the next part then. So in terms of obviously Weldricks is now offering sort of the home pelvic routines that you've created. So
yeah.
if you could just talk to us about what are these home pelvic routines?
Yeah, well, thank you so much. And it's just my pleasure to partner with Weldricks. And,
Yeah,
I sort of say in my clinic, I'm always talking to the pharmacist. I'm always referring my patients there because really,
yeah.
it's often the combined treatments of that what are available in the pharmacy and the pelvic floor training, which really works.
Mm-hmm.
But home pelvic routines are an at-home treatment for pelvic
It
floor
is.
muscle dysfunction.
Mm-hmm.
So you mentioned there at the start how embarrassing it is for people to talk about this. And
Mm-hmm.
Amy, I'm 25 years working as a specialist pelvic physio, and it's as bad today for people as it was when I started my career. And even I heard an interview recently, it was a GP was talking to somebody, and the GP said, patients are embarrassed to bring up with their
Really?
GP, and I would say to people, don't be embarrassed. It's so common. There's so much help. But I suppose in developing these home pelvic routines, this is something you can do at home. It is an online course. You do not even have to come and see the physiotherapist.
Mm-hmm.
And also, I
Brilliant.
suppose, another issue, Amy, for some people is they really dread an internal examination.
Yeah.
They really find it difficult. And, these are the internal muscles. So, we have developed this home pelvic routine, which is a series of videos and ebooks. The
Mm-hmm.
first three steps that the woman or the man can do in comfort and privacy in any device, on any device, like a tablet, a laptop, their phone. And it's affordably, priced. So, it is difficult. It's expensive. Some people can't travel to the clinic. And, having had the luxury and the privilege to work with patients for so many years, we know the exercises to give people in the right order, at the right pace, to get the results. So that's really, why home pelvic routines were created. An at-home solution that's affordable, expert created, and there's just such a need. I can't see all the patients that need to be seen. I do try some weeks, but as you say, this is such a common problem. 1 in 3 women have urinary leakage, 1 in 8 men. 50% of men over the age of 40 have erectile dysfunction. So, it's not just the women that need to, train the pelvic floor. But yeah, so I hope that gives you a flavor of.
No, definitely.
Yeah.
And I think I really agree with the fact that you said it's something that you can take and do from the comfort of your own home. So actually, where we do have patients that may be a bit embarrassed or, don't really want to travel to go see a physiotherapist, it's allowing access to medicine support at home, and patients can actually get the support they need without having to leave their house. So that's fantastic. So how does the pelvic routine work then? I know you sort of mentioned there's three stages to it, but if can you sort of take us a bit deeper into the
Yes, of
program?
course, I would be delighted. So yes, there are 3 stages to the home pelvic routines. So the first stage, you have a video to watch that is 5.5 minutes long, and you have a 12-page ebook. And let's say you were starting this today, Amy, so you would work on this first step this week. You'll have 1 exercise to do. It will take you 1 minute to do it. You'll be doing it in sitting, and you need to do it 6 times a day, spaced out. So the time involved in the first week of your pelvic floor training is 6 minutes. Then you'll be ready, a week later to add in step 2 of your program. You'll have another exercise added in, which increases the minutes from 6 per day to 7 minutes a day. And also in step 2, we will talk about the bladder muscle itself. So there'll be some talk about postures, fluid, training reflexes. And that's what you'll do in step 2. And then in step 3, again, you'll have another video to watch, 5.5 minutes long, a 12-page ebook of what you have to do in step 3. Now, in step 3, the good news is there's no new exercise.
All right,
You're still on 7 minutes. We're all so busy. We have to make it manageable. But in step 3, we really talk about the gut and the bowel side of things. And, so we talk about diet, postures, training reflexes. And, it's very helpful. And all the user needs is an email address. Once you have an email address, you can go onto the Weldricks site, you can purchase your course, you can create your password-enabled account, and then you can start your training. And
simple
then,
as that. It's very simple.
As simple as that. It's like we say here, pelvic floor training, a click away. But as well, we are here. There is always a friendly pelvic physiotherapist at the end of the line to support the user. So, some people need a little bit of help. Some people may even need a little bit of help, purchasing it to begin with. But we are here to support, the person as they use it.
So in between the steps, if I sort of started it, I've read the instructions, but maybe I'm not sure if I'm doing it right. I'll be able to get in contact with someone on your team
Absolutely.
to offer
And
some
again,
support.
that is really important point, Amy. You will, Amy, that's just a very important point about, how do you know you're doing your exercises correctly? So I suppose just to come back to what I was saying about, we are treating patients for 25 years. We are giving these exercises, very routinely. And we have put this course together that even the weakest, even the tightest, no matter what the dysfunction is, these are the steps in the right order to give you, excellent results.
Mhm.
But you will still doubt yourself. And you see, when the muscles are weak as well, you're doubting yourself further. But my tip is to listen to the videos, listen to the cues that you're given. And Amy, if I could just say, the newer way of doing the pelvic floor muscle training now is from the bowel
Mhm.
side of things in the beginning. One
Mhm.
time with pelvic floor
Mhm.
training, it was all about Kegels, which are front passage squeezing or front section squeezing, and things like stopping the flow of urine midstream. But that's
Mhm.
more old school. In the
Right.
beginning, you'll find with home pelvic routine, from what we know from ultrasound images, from MRI, that it's really important to start the training from the bowel side of things. But the
Oh.
muscles are stronger there, thicker, bulkier,
Mhm.
we have more nerves. So we actually find, Amy, that you don't doubt yourself as much with this newer way.
Of
And,
doing it.
you have to start somewhere, but you will find little by little, that the function will come back. And then, Amy, another thing that helps with that, if you're doubting, gee, am I doing it right? And, what did she say? And,
Yeah.
you get access to your home pelvic routine for a full 6 months.
All right.
So you can log on, look at your videos every day, read your ebook, you can download it, you can even print it if you wish. Now, we find that people know the exercises, and of course they're moving on to the next ones as well. But you can take your time. You can look at them, as I say, as many times as you like in 6 months.
Yeah.
So
That's really
we
good
find
that you
that's
can
a
go
help.
back to it.
That's
Oh yeah,
Yeah, that's
100%.
a help.
Yeah.
Play it as many times as you like. Yeah,
Yeah. So once I've started, so if a patient started the home pelvic routine, how
yeah,
long till they see improvements?
yeah.
How long
Well,
does it
we
take till you start to see noticeable
yeah.
improvement?
Yeah, well, we've studied this, Amy, and and again, it's based on our experience over the years. But on our most recent survey, 45% improvement was noted by 100% of users in just
Wow.
3 weeks.
In just three
So
weeks.
in just 3 weeks.
That's
So
really
like
good.
this is, like it is amazing. And then, the increment isn't as great as the training goes on. You get the most benefit in the beginning.
Beginning,
But
yeah.
we will be asking the people to do a lot of training in the beginning, right?
Mhm.
To bring their function to the normal range. And then people will only have to do a maintenance amount to keep the
Right.
muscles, tuned up and trained up. It
Yeah.
can take, Amy, 6 months. The quickest anybody will really train their pelvic floor is 6 months. And
Okay.
sometimes it can take the person 9 months or 12 months. But and a
It just
hundred,
depends with the muscles in
yeah,
each
where you're
individual patient
starting. Yeah,
and how I'm
like
doing
some,
it.
yeah,
Yeah.
exactly. There are ranges. But Amy, 100-year-old muscle can be trained. It's never too late,
Yeah.
you know.
I think that's really good to know because then some people might feel like, oh, I've left it too long. I've got
Yeah,
all these complications and not think it's for them. But actually knowing
yeah,
that you can still train that muscle, I think
yeah.
it's really valuable information.
Yeah,
That's really good.
absolutely. And I suppose, Amy, too, sometimes, the patient will need other things as well. So let's say your prolapse is, a severe prolapse. Maybe, it can be the womb coming down, it can be the bladder, it can be the bowel. Maybe you will need a ring pessary along with the pelvic floor muscle training. Maybe you will ultimately need surgery, but it's
Mhm.
very important that you keep up the pelvic floor training. It's not
Mhm.
like you start this, oh, it didn't solve my problem,
And
but
so,
again, the pelvic floor training might keep you going for a certain length of time. And then, maybe you'll need a little procedure, maybe you'll need some medication for your overactive bladder along with the pelvic floor training. So, the pelvic floor training fits in with the overall management,
fantastic. Yeah.
but again, we're always here to support the patient. And if we think they do need an individual appointment, they do need a virtual appointment, they do need individual advice, we're here to offer that.
Fantastic. Yeah. So you'd
So
be able to also pinpoint whether or not a patient might need that additional referral
yeah,
potentially. So if, I
yeah,
call in, nothing seems
yeah,
to work, the incontinence is
ex
getting worse, then you
yeah,
would definitely advise them to maybe
yeah.
seek GP appointments and things like that.
Exactly, and we would even
Yeah.
write to the GP for them,
Oh,
Amy,
wow.
and we have a little a tool on our own website. It's called a pre-appointment screening form, and it just lists the different symptoms. And all of our own patients are all the time saying, "Oh my God, I never realized that was connected," or "Oh my God,
Yeah.
I have that too." And
Yeah.
so that's a little screening tool that we use. So, there are options there, which
That's
is
really,
good.
really good. Yeah.
Yeah.
Right. So then in terms of my next question would be, so I know you sort of mentioned it, but I think it's really good for us to go over it again. So
Yes.
when should women and men
Yeah.
start pelvic routines? And also, is this routine only for women? I think it's
Yeah.
really important that we
Yeah.
tackle this. Yeah.
So, great question. So, firstly, men have pelvic floors too.
Yeah.
And, I suppose to talk a little bit about men and, why men would come to see the pelvic physiotherapist. So, men have prostate glands,
Mm-hmm.
and these glands benignly enlarge with each decade of life, sadly. This is
Mm-hmm.
very common. And when the prostate gland is enlarging, it pressurizes the bladder muscle, which is located in the body above it, and it pressurizes the floor muscles, which are located below it. And
Mm-hmm.
that's one of the reasons that men start to go very often to the bathroom. They might be up at night. They start to have a leak after they've emptied.
Mm-hmm.
And, so that's one reason. So we will see men for overactivity. Sadly, men develop prostate cancer. So that's another big cohort. And the surgery that's needed for prostate cancer will affect the muscles and the nerve supply to the muscles. And then we see a lot of men with erectile dysfunction.
Mm-hmm.
Again, as the muscle deconditions, again, partly due to the prostate gland enlarging, the muscles just aren't working as good as they were, but again, they can be trained.
Yeah.
Now, your answer or your question, Amy, about when should you start? So I really think we all, men and women, should be training our muscles from age 20 onwards.
Right.
Now, you should be starting sooner if you have issues. And
Mm-hmm.
some people do have issues earlier. And then if you're a pregnant woman, I
Mm-hmm.
like to recommend from 20 weeks.
Okay.
So, if you were doing this as a preventative rather than an essential therapy, from 20 weeks, the pregnancy is well established. The woman
Mm-hmm.
has probably had her anomaly scan.
Mm-hmm.
And, that's a good time to start the pelvic floor muscle training. And of course, any postnatal ladies, no matter how long ago they're postnatal, but, in the newly postnatal mums, the day you wake up after giving birth, start the pelvic
You
floor
can start
training.
again. Yeah.
Yeah,
Yeah.
yeah.
I
So,
think that
I
was a
hope that
total of,
answers. Yeah,
yeah,
yeah.
it
We
does.
should
It
be
really
doing
does.
it.
Yeah,
Yeah.
it was actually covered my next question because I was going to go into pregnancy and when we should start it. So I think it's
Yes.
good to know from
Yes.
20 weeks is safe to
Yeah.
do
Yeah.
the exercises. So
Yeah.
can you do these exercises in pregnancy straight up to point of
Yeah.
giving birth, or would
Yes.
you recommend stopping it before?
No, straight up until giving birth, if everything is going okay. Now, if you've other
Okay.
complications, if you were admitted to hospital a little bit earlier, if there was an infection in the body, I would stop the training. But, when you're under medical management, you'll be guided.
Of
But,
course.
and again, you can always send a question to us, Amy. We're delighted to answer, if there's any little question as people are going along with their training. I sometimes get here in Ireland calls from the labour ward, but
Yeah.
yeah, I do. And,
Oh
things
God.
can happen and that's fine. But yeah, yeah,
Yeah.
exactly. So the day after giving birth, start
Fantastic.
them, but ideally in advance. And same for men, same for anyone having surgery. If you're having a hysterectomy or, surgery for cancer in the pelvis, so in the bowel, anywhere else there,
Mm-hmm.
if you're having surgery, you need a good pelvic floor, even if you're having a hip replacement.
Mm-hmm. Mm-hmm.
Any surgery, any anesthetic, certainly will put pressure on the pelvic floor.
Brilliant. That's
Yeah.
great. Yeah, so I think we've
Ah,
covered majority of the questions I had, and I've learned quite a lot in terms of, how home pelvic routine is going to help. And I'm looking forward to starting mine actually, because
oh,
like you said,
good.
it's never too
Good, good.
soon. So
Exactly, exactly. And
yeah.
Amy, I'm here to help you if you have any
Oh, I know.
questions. Send them
Brilliant.
along.
So
Oh,
in terms of, if a patient now wants to purchase it and what's the
yes.
costs, do you mind just talking through that
No, I'd be
before we sort of
delighted.
come to the end?
So,
Yeah.
yeah, so I'm absolutely delighted. So, as we said, I have partnered with Weldricks,
Yeah.
to provide these routines in the UK. So, you go on to the Weldricks website, and
Brilliant.
if you
Yep.
just put in home pelvic routines in the search, it will pop up.
Mm-hmm.
and the cost is 60 sterling
Mm-hmm.
to £60.
Mm-hmm.
And then you know, once you've purchased, you're prompted to create your password and
Mm-hmm.
your account.
Mm-hmm.
So think of a password that you remember and you use your email address.
Mm-hmm.
So I sort of always say to people, if you can email, you'll
You
be
can
able
sign
to,
up.
you know, and I suppose this is the future. This is the digital age
That's
we're
it.
in.
Yeah.
And, you know, so we try and use technology, you know, to provide this.
Yeah. And is it
So,
quite
yeah,
instant then? So from point of
yes,
purchasing
this
straight into my inbox and I can sign up straight away.
you could be doing your pelvic floor training this evening in the next
Brilliant, brilliant.
hour. It's instant.
Great.
So,
Oh, that's
yeah.
fantastic. Have you got
Yeah.
any closing statements, Aoife, before I sort of
Yeah,
close
I
up? Yeah.
suppose just to reiterate the couple of points, you know, I was so glad to hear you say, Amy, at the start, you know, how embarrassed people are
Mm-hmm.
about these intimate problems. And it is really embarrassing and it really is hard to talk about them. But I think when you know how common they are, I think you feel a little bit, you know, better. And then, you know, if it is difficult for you to attend appointments or, you know, if finances are an issue, you know, this is an affordable at home solution.
Mm-hmm.
And, you know, if you've other health things going on, again, also that makes it difficult for you to attend, you know, you can look at your videos in comfort and privacy at home. You can view them every single day. You can read. So, you know, it's designed that it makes the learning a little bit easier.
Fantastic. No,
So
no,
I
I
hope
completely.
that, yeah,
Yeah, no, it's been very good. And I'm hoping that after this, people have the confidence to trust the
yes,
product and actually can go in
yeah.
and purchase it
Well,
for
that would be,
themselves.
yeah,
Yeah, that would be great to help them.
that'd be
Yeah.
great.
So I just want to say thank you for everybody for listening. You know, as the superintendent pharmacist, I'm always keen to open lines of communication, in particular where we feel patients feel embarrassed or unheard. So I think that, you know, offering this health intervention is going to really offer that physical and emotional support to our patients. So I really hope everybody's enjoyed the conversation. And like I said, if you need any more information, you can pop onto our website. And I'm sure Aoife and the team will be on the other end ready to support as well.
Absolutely.
Yeah.
Thank you
Uh,
so much, Amy.
but so
Thank
lovely
you.
to see you, Aoife. Thank you so much,
My
darling.
pleasure. Bye.
You're
Goodbye,
welcome.
everybody.
Bye
Bye.
bye.